Hello everyone, welcome to the 22nd European Conference on General Thoracic Surgery. Today we have a special guest, Dr. Diego, with us to share about his experience in uniportal VATS. And Dr. Diego, would you like to say hi to our friends and introduce yourself a little bit?
Hi, it's a pleasure for me to be interviewed by this journal. And I want to say hello to all the readers of Journal of Thoracic Disease and all of cardiothoracic surgery. I think that there are good platforms to show the most innovative procedures in thoracic surgery. I'm very happy about the job they are doing to promote the new techniques in thoracic surgery, in video-assisted thoracic surgery, in complex resections. So I'm very happy to be part of this platform and to collaborate with both journals. My name is Gonzalez-Rivas. I work in La Coruña. I'm from Spain. And I'm specialized in video-assisted thoracoscopic surgery, especially in the uniportal VATS approach. We developed it in 2010 in our unit, and now we are spreading the technique around the world.
Thank you, Diego. And you have bring us two new reports in this meeting, your posters introducing your new experience with the use of uniportal VATS. Would you like to introduce us about it?
Well, we presented in this meeting our experience during the last 4 years with the technique for major pulmonary resections, and we have an accumulated experience of now about 300, almost 400 cases. But here we presented the first 323 cases with the single port technique for major pulmonary resection. So we demonstrated that the results are very good. The perioperative outcomes are similar as for conventional VATS, and we are very happy with the approach. And also we have presented here our experience with the more complex resections like sleeve and bronchoplastic procedures. So we are very confident with the technique. We think that there are some main advantages for the surgeon when you have experience with conventional VATS, and when you have experience, of course, with the suturing the bronchus or the artery. So I think it's very interesting to see that the technique is not only feasible for early stage tumors or for easy cases, it's also feasible for complex cases and advanced stage of lung cancer. As we published recently at the Journal of Thoracic Disease, we published our experience with advanced lung cancer stage tumors compared with early stage tumors with very good postoperative results.
Yeah, so speaking of the technique itself, what would be the biggest advantages compared to the normal VATS?
Well, in my opinion, I'm convinced that the technique has a lot of advantages compared with conventional VATS. The first of all, the first advantage is that the technique is less invasive because we only open one intercostal space, so it's good for the patient. Another advantage is that when we adopt the uniportal approach, we are using instrumentation similar as we do for open thoracotomy approach. We use both hands, so it's important to do by manual instrumentation, and the concept of the instrumentation is completely different than conventional VATS because we work in a sagittal plane and we use both hands as we do in open surgery. When you are doing open surgery and you are using an open thoracotomy approach, your eyes are above your hands, and this is the most anatomic way to operate. When you are doing a uniportal approach, it's the same concept. The camera is in the upper part of the incision and you work below with the instruments. So the camera is like your eyes inside the chest and the instruments are below. So it's the most anatomic way to achieve all the angles inside the chest. And we don't use trocar, so it is very important to avoid compression to the intercostal space. So I think it's one of the most advantages. Avoiding the trocar will reduce the rate of compression, and I think it's very important. And there are some geometrical demonstrations, and I recommend all the people, all the readers to read a very interesting article from Journal of Thoracic Disease It was written by a surgeon who is a thoracic surgeon who is also a mathematic. His name is Luca Bertolaccini, and he demonstrated the advantages in terms of geometrical point of view of the uniportal approach. He also demonstrated the better ergonomy for the uniportal approach compared with the conventional bats. So I think there are many advantages of the uniportal approach compared with the conventional bats.
Wow, sounds like an exciting and inspiring field. That you are going to hold some training classes in China this year. Would you like to give us a preview of what the courses are going to be, and what's your expectation for the trip?
We have a uniportal bats training program scheduled from 6 to 26 of October in Shanghai Pulmonary Hospital, and from 3 to 11 of November in that hospital. And we are going to teach the technique because that hospital has one of the biggest, maybe the biggest volume of patients in the world. So we will be doing a lot of uniportal bats lobectomies every day there to teach the people who want to attend the training program all the tricks, all the tips to perform this technique and to learn how to do it. So I think it's a very good opportunity for readers if they want to attend the training program in Shanghai in October and November to learn how it's possible to do all the cases by uniportal. If you learn the right exposure, if you learn the right instrumentation, so there are many tricks to be learned. Otherwise, if you want to start the uniportal program by only having experience with conventional bats, it's not enough. So it will be a disaster. So you need to learn the tricks for the uniportal specific technique. So it's very important to attend live operations and attend courses to learn how to expose the lung, which is the most important point of the operation.
So based on the previous cooperation with the Chinese surgeons, what would be your comments to the development of thoracic surgery in China?
I think the development of thoracic surgery, especially the BATS thoracoscopic surgery in China, is amazing. I'm really surprised about the high level of BATS surgeons I have found in China. In my opinion, nowadays the best thoracoscopic surgeons are in China, in Guangzhou, Chengdu, Shanghai. So I'm very happy to collaborate with them to teach my point of view with the technique. I'm very happy about the acceptance of the technique in China because many surgeons want to learn. They are very excited about to learn uniportal bats. So I'm very happy. I'm very proud to be there and collaborate and help them to learn this technique, which I think I'm convinced that it will be the technique of the future. Because once you learn uniportal bats, you never want to go back again to the three-port technique. I'm completely sure that if you learn the technique, if you can expose the lung, if you learn the tricks, you will never go back to three-port technique.
Thank you very much for your kind words and encouragement. Thank you for accepting the interview. Thank you.